David Dayen has an interesting piece. Again, small bore stuff, but it impacts and it mitigates sort of suffering and difficulty for millions upon people, millions upon people. And we also have an example of the absolute opposite that you'll talk about in a second, Emma. But 4 major pieces of legislation passed during the Biden administration. Probably no more major legislation. The bipartisan infrastructure law, CHIPS, which was the semiconductor industrial policy stuff. The Inflation Reduction Act, also more essentially industrial policy stuff. You know, all good to some varying degree, some better than others. On balance, good. There was also the $1.9 trillion American Rescue Plan. There was a lot of great stuff in there, stuff that reduced child poverty by upwards like 1/3 to 40%. Stuff that essentially we have let, as a country, expire. And we'll talk more about that in a moment, not the least of which is SNAP. But there was a lot of temporary programs, great programs. Provided free health insurance if you lost your job and would pay for COBRA. Not the most efficient way to provide this. It was done largely because folks like Nancy Pelosi did not want people to get a taste of Medicare, did not want to reduce the Medicare rolls. You could have expanded Medicare. But nevertheless, good things, a lot of which have expired. However, there was a couple of things in there that changed that I doubt we ever even mentioned because it was too wonky and it's not shiny. It's not clear on how it helps, but it's easier to see in retrospect. And David Dayen, of course, also is very smart about this stuff. Yesterday, it announced that North Carolina struck a deal between the Republicans in the House and the legislature, Republican-led legislature, and a Democratic governor to expand Medicaid under the Affordable Care Act. It will cover at least 600,000 people who did not have health insurance. It will cost nothing for the state to do so. It's just that the Republicans hate to expand this. And here is how it was. The ACA basically set up this Medicaid expansion. Federal government pay for 90% of it. State has to pick up 10%. However, North Carolina came together. They decided to raise a tax on hospitals to cover that remaining 10%. The hospitals, it's a wash for because they're already spending $1 billion on uncompensated care for uninsured people. So now they're going to be getting
because their
fees.
State hadn't expanded.
Exactly.
Yeah.
Exactly. So it's a wash for the hospitals. Administratively, it probably saves them money. Just like in the same dynamic that Medicare for all would actually save all of us as individuals money, even though our taxes would go up because we're not going to be paying future or current outrageous medical costs. But here's the thing. The American Rescue Plan created an open-ended signing bonus if you got onto the Medicaid rolls. And it's going to mean for North Carolina an extra $1.8 billion. So we basically bribed North Carolina to take Medicaid, to expand their Medicaid rolls. And they took it. Something I can't ever imagine that we mentioned in the American Rescue Plan when it passed.
No.
An open-ended signing bonus for Medicaid. But you're talking about 600,000 people getting health insurance.
It also helps that North Carolina now has a Democratic governor.
Without a doubt.
But still, I mean, that was one of the final holdouts. Whether there are 11 left after North Carolina?
There are 11 left. Meanwhile, Oklahoma and Missouri also got signing bonuses, though that they passed their expanded Medicaid through referendum. So it wasn't necessarily that the lawmakers made an active choice, but I imagine that also dampened the push against it.
Yeah.
In North Carolina, the signing bonus, writes David Dayen, explicitly changed their mind. So that was huge.